moment for you during the surgical experience? And I can tell you for me, it's whenever I'm in the holding area and the family hands their child over to me to treat. I always get a chill about the trust that they've exhibited in that process. So I'll start at the end here with Dr. Asghar. What's your most inspiring moment during taking care of your patients with surgery?
There's usually two. One is the post-op setting when I see them back, usually at the 3-month time period, because that's when they're well enough for me to see the difference and the family to see the difference. The other awesome moment for me as a surgeon is the second I final tighten everything, meaning lock the rods in place, because I know what I've done at that moment, and those are the two times where I don't pat myself on the back, but I'm happy to be there.
For me, the first moment would be after you have that conversation with the patient and their family about their diagnosis, and they start to trust you. And at that point, they start to realize that it's the beginning of the road, but they're comfortable proceeding. And I think that is inspiring for me and for the patient, for the family. So that would be the first. And then the second would also be in that post-operative period, a couple months after, when the pain is gone and they're starting to return to their normal activity and they finally see the end of that tunnel. And just to see the smile on their face really makes it all worth it.
For me, the first one definitely is after we go through our teaching session, I'll ask the patient and the parents to explain the surgery to me. And the parent is always really nervous, and the patient, no matter how young they are, they tell me exactly what's going to happen. And the second would be at their first or second post-op visit, this Dr. Shufflebarger will come out and come to my office and say, one of your fan club members would like to see you.
My favorite time is right at the end of surgery when it's all done and everything's gone well, including neuromonitoring, and the patient wakes up with news.
And just a few minutes after that, when I'm talking to the family in the room, and you can just see that exhale from the parents, from especially the moms that are just like, wow, it's over. They've been sitting in the waiting room for 5 hours, 4 hours, freaking out, and then no matter what surgery I do, I seem to get more hugs after spine surgery. So they're very excited that their kid is off the table.
As a nurse, I really enjoy just the counseling and education that goes into helping a patient through those initial first weeks after surgery. So the time that I spend on the phone with them, just counseling them through pain management and managing mobility and constipation. And then, of course, it's 2 years after surgery when we see them back in the office for their scheduled checkup, just catching up on life and how much they've done and how surgery is such a piece of the past.
Thank you, panel. Do we have any questions for this panel of experts in all different aspects of surgical care? Yes.
A question you mentioned about where it's going in the future. Just been following a lot of research and reading about VBT. Somewhere, I know they do a lot of that at Shriners.
Would we like to address VBT?
Absolutely.
I mean, I think it's a very promising technology, and it has the ability to really change the way we approach scoliosis.
John, why don't you just explain what it is?
Yeah.
So I think it worked. Okay. It's basically a vertebral body tethering, so we'll just say it that way, is a technology that goes in where you go in through anteriorly through the chest. You apply screws into the vertebral body, and then you utilize a specially devised cable to be able to allow for growth modulation of the spine and allow for passive correction and preventing the curve from progressing. And there's a number of very conceptually, it's a very cool idea, and it has a lot of promise. But at the same time, just like anything else, it's very early in its development, and the long-term data is still unclear. So the way I always answer my families and that ask for it is, if I had a choice right now, what would I do for my daughter? My daughter would get what's called a selective thoracic fusion, which is a fusion that of the upper part of the back, leaving the mobility in the lower part of the back, and because the reliability is highest at that point. Now, if you ask me that question in 5 years, my answer might be different, but that's what it is now. And then, like I said, I think all the doctors can talk to you more about the specifics of it.
Thanks, John. Other questions? Okay, well, they'll be available for discussions one-on-one, I guess, later. So thank you very much, panel, for a great session.